I'm Dr. Douglas Harrington. I'm the Chairman and Volunteer Medical Director for the GUARDaHEART Foundation, which is a 501c3 that's conducting testing here in Baldwin Park today. We've had a very nice response in the first hour, and I want to talk to you briefly about what the test is all about here. Most of you are probably familiar with the swab test, which directly detects the virus, and it's designed for people who have symptoms. But the testing we're doing here today is designed for people who do not have symptoms, and it's measuring your body's immune response to the virus. So it's useful to tell if you've had it in the past or if you've been exposed to somebody. And it's also extremely critical for our public health departments because it gives them a better handle on the true prevalence of the disease, since the majority of people who do get a COVID-19 infection don't have significant symptoms or no symptoms. And so today we're doing that. It does require a blood draw. It's not a swab test. And we have a team of phlebotomists here who are all trained and experts. And the idea here is that we want to get you in and out safely and fast, and we'll get the results to you within 5 to 7 days. The information that you'll get from this is whether you actually have had the virus in the past and didn't know it. And number two, that information will help us identify clusters of people with the virus where we know we need to go in and maybe do a little intervention on prevention. And there are a number of different tests available. You may have heard some of the rapid tests. There are finger sticks, and there are rapid swabs for the nose. They're useful, but they're not as sensitive or specific. So in other words, a negative result is not as useful as a positive result. The method that we use here is 100% sensitive, 99.6% specific. So it's a very good test. It doesn't miss people that have antibodies. And there's absolutely nothing wrong with the rapid tests, the finger stick for antibodies or the swab for the viral antigen, but they have to be repeated more than once if they're negative or if you have symptoms in order to catch a positive result. And so they're useful for rapid screening and answering questions in a very quick way, but they may need to be repeated frequently until you're certain it's either negative or they're positive. So there is some concern today about a surge in the viral infections that's been reported in the media. What's important to keep in mind is that surge is predominantly in the northeast of the country. It's in a highly populated area like New York City, those areas, and it seems to have followed where the temperature has gone down and people are clustering inside, more likely to infect each other. And yet, as we're learning, the actual survival rate for the virus overall from the CDC data is 99.5%. And if you're less than 30, it's like 99.97%. So we've gotten very good at treating the virus. We're learning how to keep people out of the hospital. There are multiple drugs that have been shown to be effective. And I think with this surge, one of the things that we want you to keep in mind is the FDA stipulated that a vaccine for this virus had to be at least 60% effective. What we found is there are 18 vaccine candidates out there, 4 of which have already reported results that show they are greater than 95% effective, which is a magic number given the fact that the FDA stipulated 60%. And 2 of those have already applied for emergency use authorization with the FDA. They're actually being deployed as we speak. And I'm expecting that in the first quarter of 2021, there will be more vaccines deployed. And I think that that will help us get a handle on what we call herd immunity. Not everybody has to get the vaccine, but the more people that do, the quicker we get to herd immunity. They're all very effective, and I just want to let people know how remarkable it is that in less than a year, we have developed significantly effective vaccines that normally take years to develop, and their effectiveness is just remarkable. So I think there's a lot to be hopeful for. Just to reiterate, we have vaccines on the horizon that appear to be super effective. We have newer ways to treat people and keep them out of the hospital. We actually have a significantly higher infection rate than people thought, and the death rate from this virus is significantly lower than we originally thought. And so, you know, there's a reason for hope. So we've also seen some interesting statistics in Los Angeles. As you know, nationally, the African American community was running an 18% infection rate, and the Hispanic community was very similar. And what we found in Los Angeles and multiple sites is that the African American community is running probably 3 to 4%, and the Hispanic community is running around 14%, mirroring the national. But the African American community in certain parts that we have tested, like South Central LA, Baldwin Hills, had community outreach programs from various community organizers and their city councils. It appeared to be very effective at educating people on how to prevent infection and how not to contaminate things. And again, I do this every time I give an interview, but I'm going to stress the one area that you really need to pay attention to, outside of the ones we've highlighted, is your bathroom or public bathrooms. Because, as you know, we're able to detect the virus in sewage. That's how we're tracking outbreaks in various buildings and communities. That means it's coming out in your waste products, your urine and your feces. And because of that, toilets are capable of flinging droplets up to 20 feet away. So you should make sure that if there's a lid, you close it, keep your mask on and hand wash after going to the bathroom. And if you have somebody in a house with more than one bathroom and they're infected, they should use one bathroom exclusively and the rest of you should use the other one. And that will actually help reduce the infection rate. There is a lot of controversy about shuttering restaurants and preventing eating outside. And there are a number of lawsuits involved in that. And being very careful not to go against our public authorities who have the legal right to implement rules and regulations. The real issue is, what is the data that shows that restaurants are a significant source of infections? And the data does not support, to a large degree, restaurants as being a big source of infections when people are eating outside or they're doing deliveries. And I think we have to balance the consequences of losing a significant part of our economy and harming people who may have put their life into these restaurants against the very low risk of infection from those sources. And the way that should be handled, that we recommend, is that anybody working in a restaurant be tested regularly, that they use adequate precautions in packaging and keeping things sterile, no touch, gloves, that sort of thing. And that we actually rely on the data that we can get to determine whether we should do that or not. So I'm hoping that they revisit this, because I think it's in California in particular, we can eat outside. We can do what they do in Europe in some of the warmer climates. But places like New York, where it's very cold, New York City, it's going to be very difficult to do the sidewalk dining without heaters and that sort of thing. So I'm hopeful that the authorities will revisit the data and maybe make some determinations that with specific guidelines, restaurants can remain open for delivery and outdoor dining, especially in California. So one of the questions we get is, are the drive-through finger prick tests for antibodies as good as the serology that we're doing here, where we do a formal blood draw on a patient? And the short answer is they're okay. They're not as sensitive in general, but the ones that have been EUA, that's emergency use authorized, are pretty good. They're actually somewhat reliable. It's not always useful if they're negative. If they're positive, they're more helpful, and they may need to be done more frequently if you are negative, just to confirm it. So in general, I don't want to discourage finger prick tests because they're rapid and you get a result quickly. Tests like we're doing here are considered the gold standard, where you do a formal blood draw. They have a very high sensitivity and specificity, and we know the sample has been handled correctly. Whereas with a finger stick, you can get conflicting interferences from it. There's some skill required in collection. And to be honest with you, a finger stick hurts more than a blood draw. So, okay. So another frequent question that we get is, can you get reinfected? And honestly, in looking at the data, there are very few documented cases that would be considered reinfection. And for the most part, those were in individuals that had significant immune compromise, like cancer or an autoimmune disease or some genetic defect. The risk of getting reinfected is extremely low. I mean, extremely low. And for a number of reasons. One is that when you're experiencing the virus, your body mounts an immune response to it. And even if that immune response tends to dissipate with time, where it's not detectable, you are still protected because your body has what are called memory B cells and memory T cells. And if you see the virus again, assuming you have a healthy immune system, then what happens is within minutes your body is making new antibodies and there are cells that are attacking the virus. So you're protected. The immunity appears to be significantly durable, and the more data we get, the more it appears to be a good thing. In closing, I would like to thank all of our volunteers here at the GUARDaHEART Foundation who are conducting these testing events in conjunction with communities and churches and whatnot. And just so you know, GUARDaHEART Foundation is a 501c3. It's about 10 years old, and it's dedicated to preventing disease. It focused primarily on cardiac disease, diabetes, and obesity. But with COVID, it's clear that we had to get involved there. And everybody in GUARDaHEART is a volunteer. We have no salaried employees. 100% of the money that comes into GUARDaHEART goes back to the community in events like this. And if you want to donate, please go to GUARDaHEART, that's GUARDaHEART.org, and there's a link there, and I guarantee you the money will go back to the community.
Good morning, ladies and gentlemen. My name is Mike Salas, Program Supervisor with the City of Baldwin Park. It's great to have GUARDaHEART Foundation providing their services to the community. This program here is very helpful for the community to find out exactly what's going on within their own body with the blood. Of course, with this pandemic of COVID-19, it's even that much more important to go ahead and have blood drawn, so that this way they'll be able to find out if you have any other ailments that have probably that have happened throughout the years in your body. You'll be surprised. Hopefully everything's in a good note. But more importantly, this is all about preventive medicine. We need to go ahead and continue to have blood work, so that this way you'll know exactly what's going on within your body. The city of Baldwin, with the COVID pandemic of COVID-19, it's hit Baldwin Park. It started slow here back in March of 2020, and then little by little, with the testing going on, it helped those that were infected by the COVID-19. So that's been very helpful, letting the community know what's going on with the surrounding communities of the San Gabriel Valley area, and also the Los Angeles County, San Bernardino and Riverside counties. So this has been very helpful for the community to go ahead and follow the CDC guidelines, so that this way they will prevent of acquiring COVID-19. But the city has done well in communicating and educating the community. Like I said earlier, GUARDaHEART Foundation has been very helpful in providing their program with us this morning. Actually all day, today from 9 to 4, tomorrow from 9 to 4, and also Saturday from 9 to 4. So this gives everybody an opportunity to come on down and take advantage of this no-cost antibody testing.